Hello everyone, I am Dr. Geet Bajpai. I am consultant nephrologist and I am working in Venkatesh Hospital, Dwarka, New Delhi. So welcome to today's session on pedal edema and chronic kidney disease. Today we will explore what pedal edema is, what are the causes of pedal edema, how it relates to CKD and what are the best ways to manage it. First, let's see what pedal edema is. So pedal edema is a condition where extracellular fluid accumulates in the lower limb and or basically feet, and it causes them to swell. So this swelling can happen for several reasons such as heart problems, liver issues, thyroid issues, kidney problems, or there can be blood clot in the vessels which are causing the edema to arise. So our body fluids are basically divided into two main areas. So one which is inside the cells and the other which is outside them. So outside area is considered as a interstitial fluid or extracellular fluid. So basically this fluid part is again divided into two compartments. Basically one is interstitial fluid and one which is inside the blood vessels. So edema or swelling occurs when there is a problem with how fluids are distributed between these areas, that is intracellular compartment and extracellular compartment, which is again comprising of interstitial fluid and fluid volume which is there inside the blood vessels. So this problem can happen if there is too much pressure buildup in the blood vessels, often due to heart issues or excess fluid, or it can also occur if there aren't enough proteins in the blood like albumin, which usually tend to hold the fluid inside the blood vessels. So if there is less albumin in the blood vessels, there will be less oncotic pressure generated and there will be extravasation of fluid from the blood vessels into the interstitial tissue, ultimately causing pedal edema. Also, the lymphatic system normally keeps fluid in the blood vessels and helps the extra fluid which has accumulated inside the extracellular tissue to and direct it back to the blood vessels. But if there is problem in the lymphatic system, again there can be buildup of fluid and which can again lead to swelling of the legs or pedal edema. So kidney plays a very important role in regulating the body's fluid balance. The kidneys help remove waste and regulate fluid when they are not functioning properly, and fluid can accumulate leading to edema as seen in CKD, acute kidney injury or nephrotic syndrome, which is a state in which there is too much loss of albumin or proteins in the urine, ultimately causing hypoalbuminemia, that is low albumin in the blood compartment, and ultimately causing extravasation of fluid into the interstitial tissues. So edema is one of the major symptoms of CKD. Also, this edema can increase so much that can lead to pulmonary edema, that is accumulation of fluid inside the lungs, and can cause internal drowning for the patient. Patient feel breathless, and ultimately this can also necessitate the need for dialysis. So let's explore how clinicians approach the diagnosis of edema. First, a detailed history helps identify risk factors and underlying conditions like heart failure, kidney disease and thyroid disorders. And edema can be divided into two main categories. Either it can be a generalized edema or it can be a localized edema. So generalized edema, this type affects the entire body or large areas and often linked to the conditions which are systemic in nature, which are involving whole of the body like heart failure or kidney failure or liver failure for that matter, or if there is generalized hypoalbuminemia or very low hemoglobin levels. So all these are conditions which lead to generalized edema, and then there can be conditions causing localized edema. So this type of swelling is just confined to one of the areas of the body, like just one limb or maybe just the right or left upper limb. So it is mostly due to the inflammation or blocked lymphatic fluid or issues within the veins of the limb. So these are the major important causes which causes localized edema. So during a physical examination, what we are actually looking at? So we are looking at whether the edema is pitting in nature or non-pitting in nature. So for pitting edema, if we press with the thumb over the swelling, there will be indentation after the pressure. So this suggests that there is a pedal edema, pitting edema, and the major causes are heart failure or nephrotic syndrome or liver disease. While if there is no pitting seen after applying pressure through the thumb, then it means that there is either a lymphatic obstruction or hypothyroidism. In cases of renal diseases, the following lab tests and imaging are helpful, like CBC, renal function tests, that include serum creatinine value, which can ultimately give you a value of how much your kidneys are functioning, that is called as GFR. And you can also go for a urine analysis, urine microalbuminuria or urine albumin to creatinine ratio. These are all the tests which actually tell you how much protein loss is there. So if there is too much of protein loss, say for example about 3-4 grams or more than that per day, that means the patient is having a nephrotic syndrome, and this will ultimately cause a pitting edema. And we can also go for an ultrasound of the abdomen and pelvis. A thorough history and physical examination, like I told you, are the key, and identifying systemic causes and specific signs actually further guide the management plan, because if you do not have the exact reason for edema, then you cannot treat it in a very proper way. So when it comes to managing edema, the approach depends on whether the cause is local or systemic. For local causes, non-pharmacological measures are essential alongside addressing the underlying issue. For systemic causes, a combination of general measures and a targeted treatment is warranted. For local edema, non-pharmacological measures include limb elevations, so regularly elevating the affected limbs helps reduce swelling. Compression therapy, like wearing a compression stockings, can assist in improving blood flow and reducing edema. Physiotherapy, like massage and other physical therapies, should be performed by trained professionals. Ice application, useful for severe or congested edema, and often is used or employed in cases which have inflammatory causes of swelling like cellulitis. In cases where systemic causes are at play, such as CKD, treatment focuses on reducing fluid retention and addressing the underlying conditions. So this will involve salt restriction, because limiting salt intake helps prevent fluid buildup and manages the volume overload. This would be beneficial in patients who have liver disease, patients who have heart failure, patients who have nephrotic syndrome, and also patients who have hypertension or CKD. So in all these cases, salt restriction should be employed. For otherwise, we can employ diuretics. So these are the medication which increase urine output to help manage fluid levels. So there are different type of diuretics which are available, like loop diuretics, for example furosemide and torsemide, often preferred for their effectiveness and longer duration of action. The other classes of diuretics are thiazide diuretics like metalazone, used adjuvantly for enhanced diuretic effect. The third class is potassium-sparing diuretics like spironolactone or amiloride, used cautiously due to potential risk of hyperkalemia. But many times we have to combine these therapies, because loop diuretics or thiazide diuretics can lead to low potassium level. So we can add on potassium-sparing diuretics so that we can maintain a good balance of electrolytes. So the choice and dose of diuretics depends on the factors like severity of edema, the patient's hemodynamic status, and kidney functions. So it's important to use diuretics cautiously to avoid complications like hypokalemia, hypotension, and other electrolyte imbalances. So regular monitoring of fluid overload, urine output, blood pressure, weight, and periodic tests are essential when we are employing diuretics for edema management. In chronic kidney disease, managing edema often requires salt and fluid restriction, because it is essential to control fluid retention, and high dose diuretics are often required, because as the kidneys start getting weaker, you will require higher doses of diuretics as compared to doses which are employed in patients who have normal kidney function. So managing edema involves a tailored approach. For local causes, non-pharmacological methods are key, and systemic causes require dietary adjustment, diuretics, and close monitoring. So patient education is crucial. Understanding the condition, following the treatment plan, and making lifestyle changes can improve outcomes. Early recognition and effective symptom management help prevent complications. So join us in recognizing National Edema Awareness Day on September 25th to increase awareness and promote early detection of edema and related conditions. Together we can manage and understand edema better. Thanks for watching.